because I know we've already used up so much of your time. So by the time I try sharing my screen again here, which is what started it all before. Yay, it worked. Okay, so so just a reminder, like last week, just make sure and pass down this information to any of your secretaries or nurses or whoever might use it. To begin with here today, I'm going to go over triaging sick students, sick employees, how to use the flow chart basically. And so I just want to make sure and do it in the beginning so that you could pass it on easily to those that need to use it. Oh, let me do this. It's going to be easier. Okay, so this is from your toolkit that we've provided with you. This is an algorithm we put together to help work through that decision making if you have a staff or a student with symptoms. So it should be page 7, depending on how your pages are numbered per each health department. So for a staff member, you're going to use the yellow box. If they have one of the major symptoms, fever, cough, or shortness of breath, or 2 of the more minor symptoms, which we've shortened the list, this is based on state recommendations. It's not quite as inclusive as the CDC, but if they have 2 of these symptoms, then they should, excuse me, they should not return until it's been the full quarantine period. This is according to the CDC. The CDC recommends, and this is a direct copy and paste from this site, that sick employees should stay home until they've met discontinuation for isolation. It's not until they have a negative test. However, we understand that this is not the easiest thing in the world to do. So it is up to your discretion. We are not going to approve this for you because we can't really go against the CDC, but it's up to your discretion if you're going to let staff come back sooner. But according to the CDC, if you have staff with these criteria, they should stay out for the full isolation period. The reasoning why is that depending on when someone gets tested and how well they're tested, they can have a false positive test. And it can be a pretty high rate of false negative tests. And so you may have a staff member that has a fever for 1 day, and they could have COVID, and they could have a negative test, and they could inadvertently come back and infect others. So again, it is very difficult. We know it causes staff shortages. We know it's just very, very challenging, but that is the recommendation. Again, it is up to you and your HR department and legal and everyone else if you want to do something different, but this is the recommendation. So for students, you start with this top blue box. If students have any of these symptoms, there's a shorter list here because tend to have a little different presentation, and kids tend to have a lot of other illnesses, and kids tend to be a bit less contagious. But if kids have any of these symptoms that are new or different, and the adult one said new or different as well. So if they have fever, sore throat, a new cough, diarrhea, vomiting, abdominal pain, or a new severe headache, especially if it's with a fever, the headache's a little, you need to take that one into consideration with other things. They should go home. Just one thing is they're sick, so they need to go home. So that's step 1. Step 2 then is to decide what to do next. Once they're gone, once they're excluded for school, in terms of returning from school, you need to think about, have they been at risk for an exposure to COVID? So that's, these first 2 are from the CDC. Have they had close contact with a confirmed case? This one we don't typically consider a risk, But with this, I think they're trying to be of the better safe than sorry mentality. So have they been in contact with a contact? So someone who's in quarantine for an exposure. Have they been traveling somewhere that could be a risk? And then are they living in an area with higher community transmission rates? And that's what we've been going over every week. So we again, on err on the side of caution. So what's the likelihood that they could have COVID? I'll go over your data here in a minute, but right now, these counties are in that higher level. Now, realistically, there's other reasons why they might be in those higher levels, but we want to be as safe as possible. So all this is saying is that if those kids have those symptoms in these counties, they need to have further evaluation. So if they've been in areas with higher amounts of COVID, they've been exposed, you next go to the yes side. My next slide says another thing you can do if you don't remember what's going on or you think things have changed, you can go right to the link. It's a live link in there. You can go right to that link, which is the My Start map. You select your county from this drop down. You click the little arrow by the epidemic spread, and then you can see the test results and the new cases. If either one of them are in the 1, 2, or 3 category, so if they're dark red, red, or orange, then that's a yes. So that's where we're getting those names of counties from, is that those counties would have been in this yes range. So this one I pulled, this was Clare County. They were both blue, so that's low risk. Sorry to pick on you guys. I just pulled the counties that I knew would fall into it. And these numbers actually were a few days old, so things have already changed. But this one here, the cases per million, this one is red, so it was high risk. So if either one, it's not both, but either one of them, you would say, okay, so the answer then is yes. So now you go, you go to yes. So that child who is having those symptoms and has been sent home needs to now go to a healthcare provider and or be sent for COVID testing. Then after that, if they are diagnosed with COVID or their healthcare provider did not find anything else wrong with them, so they didn't say, oh, they had a bladder infection, they had an ear infection, some other explanation besides COVID, they need to stay home for the full isolation period. If they have a negative COVID test, the next thing you want to know is, were they a close contact to someone with COVID? If they are a close contact, and we'll talk about this, I put a slide in later for this because this is a common question too. Any close contact needs to be home for 14 days, regardless of whether or not they've had a negative test. So again, close contact, yep, okay, finish your 14-day quarantine. Close contact, no, we had a negative test, we're not a close contact, this is for students. Then we go to this last box where they can come back then based on whatever their symptom was. So if they have a fever, they can come back 24 hours after their fever has passed. For everything else, it's basically once they're feeling better. Strep throat, there's some specific requirements for that. The other arm here that we didn't address, if you come down to the blue box and you say, no, they haven't had any of these high risk issues for COVID, then they can come back based on their symptoms. Now, this is a bit confusing. If it's too confusing, I have shared some other algorithms from Oregon. They basically just take this step out of it. It will be a bit easier. It will be a bit more cautious. it will likely cause you to have more students out of school. And now to go over your data a bit, let me, okay. So, this there is a private access site to the My Start Map. So there are a few different data points in here that I have that Michigan's cases have been going down, so it's -2. And this is the tests weekly trend. So it's saying for the last 2 weeks, Michigan's test positivity has been going up because it's not a minus. I kind of think of it as like a +2.
Sorry, Dr. Morse. Are you currently sharing your screen? Because I'm not seeing it.
Okay, thank you. I must have just.
It's okay.
I am trying. I thought I was sharing my screen.
You were. It was just when you switched the
All
data,
right.
for some reason it switched back.
Come on. There. Is that better? All right. You can see that now? Yep. Okay. So yeah, so here's the cases weekly trend and the test weekly trend. So
like she fixed it.
I've been able to pull data a little differently here. So
Thank you.
and I've separated them.
I'm still not seeing the screen.
Still not seeing the screen.
Mm-hmm.
Let me. Now do we have it?
No.
What the heck? What is going on today? Why would... Come on. Share. Really, it's not showing that?
No, when you switched from your PowerPoint to the regular data, it seemed to not like that for some reason.
Huh. Well, I'm going into the share and I'm telling it to share this Word document, but I guess I'll just have to send this Word document out. I'll first just describe it though. I have a table with all the counties on there, and on the top I have labeled you know, the different categories of the data, just like I have before, and then the different, I have them all color coded. The ones that are medium, high, medium, high, or very high. I have provided some explanation. So for Isabella County, you are coming down, which is good. You are still in a high category. However, I went through the data for the last 2 weeks, and if we took all the CMU cases out, your daily case rate would be 2.85 cases, and you would have 41 daily cases per million, which would be just over the medium high category rate. It was a lot higher. When I pulled this data yesterday, it was in the 60s. The data just changed today, and so I copied and pasted everything in really quickly this morning, and so now it's only 42. So it doesn't look that dramatically different than it is without the CMU data in there. But just know that it is quite a bit different without the CMU data. Osceola County is medium high risk. There really isn't a whole lot of pattern to those cases. There's not a whole lot of cases. It's just that the population is pretty small. Roscommon County is in a medium high risk group, just barely into that category. Same thing, not really much of a pattern, not really that many cases, just small population. Mecosta County is in a very high risk category. However, looking at the last 2 weeks worth of data, a huge proportion of the cases are from Ferris State. And if we took out all the Ferris State cases, you'd have only 0.92 cases per day, which is 21.3 daily cases per million, which is just over the medium high risk group. So big difference there. And we have a lot of other counties here. I guess I'll save time, but I did provide an explanation for each county that is in one of the medium high or very high risk groups after reviewing 2 weeks worth of your data as to what kind of pattern there is to your data, or if there's any pattern at all to your data. So we'll email that out to you. So if I put back up my PowerPoint, do you see that?
No.
No? All right.
No.
I cannot see your PowerPoint.
No, that's all right. I will fiddle with it. I'm never letting Janine go on vacation again. All right. Let's try that. How about now?
Nope.
No, sorry.
So Pete, what's going on?
Oh, got something.
There it is.
Okay.
Oh. Have I lost it again?
Whatever you did, do it again.
Yeah, so you might want to give it a second.
Yeah.
I'm still not there.
Anything?
No, not yet.
It tells me it's sharing it. Well, jeez.
Something.
What did I do?
Well, I'm just going to talk. And if it decides to pop up, then deal. So I'll also send you guys out to our main email address a copy of the matrix that we'll use to help guide schools with decision making about in-person versus remote learning. It was something that was developed between MDHHS and local health departments. It is meant as a guide, not a rule, and it is meant to help us advise you, is the purpose of it. It's meant for internal use, so we ask that it not be shared. And you still can't see this?
No.
No? Oh, goodness. Okay. Shoot. So on the matrix, it's really wordy, but it'll say the first step is you just determine what phase you are in. So those phases are as explained in the My Safe Schools roadmap. So most of us are in phase 4. Region 6 and 8 are in phase 5. There is a map for that on the state website, and I have a link for that in the presentation, and also a picture of the map in the presentation, just as a reminder. But that really shouldn't change, but that is the first step. The second step is to look at your county information and those counties around you if your school district pulls from other counties. And that is what we just did. Even though you couldn't see it, we just went over your data. And again, there is a private access portion that we pull some additional information from and can share with you as well. The matrix goes over the data that you want to look at, which is the cases per million and the percent positivity. They include, in the data that we share with you, it includes confirmed, lab confirmed cases as well as probable cases. It excludes cases that are in correctional facilities. And it goes over, what they mean by low risk, medium risks, all those things that we've been discussing all along. It states that if there is a discordance between the risk levels, you should go with the higher risk level. So you'll notice that for most of all of our counties, the percentage rate is always in a lower risk category than our cases per million. And so we go with the higher risk level, which you can argue either way, but that's just on the side. So there's also in the private portion of the MyStart map, they have a 3-day surge indicator. So if a county is having 10% increase in cases per million over 3 consecutive days, it'll actually flag it on there. So that is something that they've put in there to help us to keep track on high increases. And also if there are 5 days with sustained increases. It also says in the matrix that all of these statistics should be assessed by the local public health official in the context of outbreaks in the community. So that's kind of what I just went over with you, looking at Isabella County in the context of CMU, looking at Mecosta County in the context of FSU. Gratiot County had a couple of school-based outbreaks, and so there was some information in there about that as well. So again, we'll look at all that while also looking at the bigger picture of where are these cases coming from. It also goes on to say that there are other data points that will be included in that that private portal of MySafeMap, which is deaths in the county. It also does have some syndromic data. So it talks about like how many people are going to the ER with symptoms of COVID, and they're going to be adding data on hospitalization rates. If you've noticed, there was an act that was passed about education, which talks about different data points that should be monitored. And so this will cover all of those. And so we'll keep all of that in mind as we provide guidance. So the third step says to use all the available data on the cases in the community and the association with school buildings. The local health department should work with each school district to determine which column of the chart, which I can't show you, but I will send you, that their district is in. And that will make use with case investigation and contact tracing to assess if the building in the district has known cases ongoing in the building. So let's try one more time here if I can share my screen. The grid then takes into account what your activity is in your county, and then also if you have cases in your school or if you have ongoing transmission in your school. And so, for example, if you have medium-high activity in your county and you have a case in a staff member or a student, you really just want to make sure you have good cleaning and contact tracing, but you can continue in-person education. However, if you start to have ongoing transmission in the school, you should consider reduced density in the affected building after an appropriate pause, which is typically a 14-day break in education. So that would be, if you had medium-high activity in the community and ongoing transmission, which is typically described as 3 or more cases in the same building within 14 days that are definitely linked to each other. So the only way those 3 people would have gotten COVID was through their interactions within that school building. And then, we're a little more aggressive in communities that might have high or very high transmission. Again, if we know that transmission is community transmission. So again, if we get very high transmission in Mecosta County, however, you take out the FSU students, we don't think those students are really going to affect our K through 12 and teachers, we would treat that differently. And then it goes on to explain what they mean by different actions like mitigation measures and reducing the density in the school and things like that. So it's pretty wordy and it leaves a lot of wiggle room for us to work with. But at least it is some good guidance and it is quite flexible and reasonable. And then I did put a slide in here that's just talking about close contacts and being tested for COVID, because this is something that comes up quite a bit. And I'm sure you have probably heard it or heard of people talking about it, but someone who is in quarantine gets tested and is negative, and they say that they can come back to work or to school before their quarantine is over. I've provided in one of the slides here a copy and paste with the link to the CDC, one of the places on the CDC where it documents that you need to still quarantine for 14 days because a negative test does not rule out possible infection. So just so you have that proof that no, they cannot come back early if they have a negative test, if they've been a close contact. I also included in a slide here some information about school outbreaks. They are now listing them on the state website. I put a link to where they're being listed and also an explanation of how you can find it through the website if you don't have the link. And then I put a link to what a definition of a school outbreak is. It's essentially 2 or more cases within 14 days that occurred within one school building that there was no other way that they could have caught it from each other besides the school building. So they're not housemates, they didn't go to a birthday party together, they're not in any other activity outside of school together. So we would be really definitive about, they definitely caught it from each other in the school and nowhere else. I put just a brief message in here because this is something ongoing that I'm trying to work on. We just ask for your support, just continual messaging to kids and teachers and parents that no matter what any of us do, it is very likely that every school will have at least one case of COVID before this is done, if not many. And to be patient and to cooperate with the health department, and to know that if it does happen, they might have to have a child home at the drop of a hat in quarantine, and to have preparations made for that in case that does happen. We just want everyone to have a realistic understanding of what this school year will be like, so that if the health department does call them, we get realistic conversations and don't have overly upset parents that, weren't expecting this to happen. So we just ask for your help to continue that discussion. So we will send out these slides. I'll send out your data graph and the matrix. Again, I ask that you not share the matrix, and we will not be posting that on the website. I really apologize for the technical issues today. And then once we get the video converted, we'll post that as well, although it won't be terribly exciting today. I will go to the chat here. I don't know if we have any questions. Looks like we do.
The first one was in regard to if a student, I'm guessing this is from Jason, if a student chooses not to get tested or the other, like in the flow chart, like what happens with that student?
So again, if they have symptoms, they're in a setting where there's community transition or risk for COVID, and let me see how I have that worded. There's no other diagnosis and you don't have a negative test, then they need to stay home for the full 10 days. So yeah, because the way it's worded, diagnosed, so the box says diagnosed with COVID or no other diagnosis available. So that's where that would fall under. So basically, you haven't ruled out COVID, you have no other explanation for their symptoms, therefore they need to stay home for the full isolation period.
Okay. And so he said, so basically symptom-free for 24 hours or improved student can return.
10 days after the onset of symptoms and 24 hours without a fever, and they feel improved.
Okay. All right. Next question was, are rapid tests included in the positive rate for determining risk categories, even though they have known reliability issues?
So there's two kinds of rapid tests. The most common traditionally, until more recently, is rapid PCR testing. Rapid PCR testing and your traditional PCR testing is considered accurate. There's a little less accuracy with rapid PCR testing, but that is all considered a diagnostic test. Rapid antigen testing can be a problem. And there are instructions out there regarding how to handle rapid antigen testing. And if someone doesn't have symptoms and is positive, they're supposed to immediately get a confirmatory PCR test done. And if it comes back negative, then that case is canceled. If they're symptomatic and they have a negative, it's supposed to be confirmed. So there are procedures for that. How well they're followed, it's hard to say. When we get an antigen test, it is only considered a probable per case definition. Probables are counted as a case, but they are separated out in the reports. But we do communicate with the patient and with the provider. And if they're not symptomatic or if they're in those lower risk categories, we ask about a confirmatory test. So I know it's really confusing, but again, rapid antigen testing is the test that we have the big concerns about, false positives especially.
All right, thanks, Doc. Next question is, I have schools in different counties, including different health departments. How does that impact closure districts wide?
How does that impact what?
Closures district wide.
Well, we don't tell schools to close. If there are extremely high rates of illness or outbreaks, we'll work with the schools to help give them advice, but unless there's a really unusual situation, we will not order the school to close, but we'll provide guidance. And so we do definitely have school districts that cross county lines and cross school district lines. I believe for Bob, you cross my school district, you come across my health departments. So for some, you have some consistency there. But typically you have one health department that's more predominant, has more of your territory, or that you have more communication with and use their guidance. But again, we're typically not going to be calling and saying you must close down. We're going to be an advisory role. I don't know if any of our health officers want to add to that. All right.
Bob did have a follow-up. He said, according to the flow chart, last bullet of the blue box right middle indicates exclusion if living in an area with high levels. Isn't that true for both Isabella and Mecosta counties?
Yes. Yep, and they were, I don't know when I lost my sharing ability, but they were both listed on the slide. That it was Isabella, Osceola, Roscommon, Mecosta, Missaukee, Oceana, Newaygo, Kalkaska, Crawford, Mason, Clinton, Gratiot, Montcalm. And, it changes day to day, and you always have the right to just say everybody and not have to worry about it either. This is how the CDC has it set up, that you will evaluate their risks for exposure. It makes it really complicated. And so you can just play it safe and say, well, everybody could be at risk. So everybody with these symptoms need to be evaluated. It just does add to the absentee rate and makes it a bit more challenging.
Okay. Next question is, when people are returning from other states, either by car or plane, must they quarantine prior to returning to school?
So that information is in it's in the slides from last week and the week before. There is no official recommendation to do that. You can choose to do that if you wish. However, you need to then watch the states for their activity, just like we watch the counties for their activity, and make your own decisions about that. But there's no official recommendation to do that. There are some guidelines on the CDC about, if people go to parties or funerals or different things out of state or in state really, or different things, you can take extra precautions. It gets challenging to know everybody's travel plans. And so those are more of an internal HR discussion and something that is really left to you and your school.
Okay, thank you, Doc. Next question is, do you contact trace in churches?
We contact trace if, if individuals know who they had close contact with. So if they know who was next to them in their pews, we will individually call and trace those individuals. A lot of times they don't know everyone they had contact with. So pretty universally, we communicate with the church and ask them, and I don't think we've ever had a problem with this, have them notify the entire congregation that somebody was in that church. Because again, people are usually talking. Sometimes they're singing, which is a bit high risk. So we just have them notify everybody because they don't always know who they've talked to or remember. But again, if there is somebody we know met that definition of a close contact, we will specifically call that person and put them into our monitoring system in addition to notifying the whole church. Yes.
All right, thank you. Jason, I saw that you had a couple of other follow-up comments / questions. Did we fully answer your question, or do you have anything to add for that?
I think maybe he's saying that the kids have symptoms, but the parents don't do what they're supposed to do. I know it's really hard. I know we got a call from our kids' school reminding them to, you know, not reminding them to be clear when they call kids in sick and things like that. And I know this isn't easy. And, you know, I honestly, I'm not really clear about what you can require of students before they return. And I just do the best you can.
All right. The next questions are from Catherine. Thanks for being patient, Catherine. We've seen your hand raised for a while. First question is, do students have to wear masks during indoor PE class?
I believe they do. I'd have to double check the My Safe Start, the back to school guide from the state, what the requirements are. But I believe they do.
Okay, thank you.
And then the second question from her is this: if having gym inside, is it 25% of gym capacity or 25% of the class?
I can't remember that off the top of my head. I'd have to go back. It's been a while since I've read those guidelines, so I'd have to go back and reread them.
Okay, thank you.
Yeah, I'm sorry.
All right, that seems to be all the questions in the chat box. If you have or if you're on a phone or something else that doesn't allow you to type, if you want to go ahead and unmute yourself and ask a question, we'd be more than happy to hear it. Okay, Doc, I think that's crickets at this point. So I think we might be all set for today, unless anyone has any last minute things.
Well, thank you everyone for your patience. I know this was a rocky one, but we'll get out all the information to you as soon as we can. The video might be a little bit delayed just because our normal video person isn't here, but I think she has helpers in line to help out. So we'll get everything out to you. Thank you so much.
Thank you.
Mm-hmm.